thank you very much for including consumers as part of this conversation and those that advocate on behalf of consumers. As Dr. Raymond said, I did cut my teeth in advocacy working with STOP and got to know Ronnie Rudolph Austin very well. Her daughter was the first to die in the Jack in the Box outbreak. So I've been around this issue and working with individuals who've become ill from the simple act of eating for many years now. So that's a little bit of who I am. I think I was kind of brought here to kick the hornet's nest. So that's what the title of this presentation was hoping to do, at least to grab your attention with the idea that this might be one of the perceptions that consumers have out there. So a little bit of CSPI, who we are and what CSPI does. We have worked on food attribution in the food safety department, but we're also, just a little background, we're a binational consumer advocacy organization. We were founded in '71 by Mike Jacobson. He has a PhD in microbiology from MIT. The whole of CSPI focuses on nutrition, health, and food safety. We publish an award-winning Nutrition Action Health Letter. It has no advertisements in it, so it's just researched and well-written articles. We're approaching 1 million subscribers in both the United States and Canada. And I think an important fact here, we accept no government or industry funding. We're mostly supported through subscription to the Nutrition Action Health Letter and through grants. So a little bit more about what we do. Some of the reports that we have put out, like Dr. Raymond said, we've worked on food attribution for quite some time now. Every year we publish Outbreak Alert. CDC now has the food database that we pull from, and they recently released a painter. John Painter put out a paper that was looking at attribution as well. So we're glad to see and applaud CDC for sort of taking that on. And Mike Batts is another researcher who's been working on attribution. But CSPI has been doing this for quite some time. And I've been there less than a year, but am working on that database and sort of loving it and working with it on a daily basis. So that's a big part of my job, is to work on our foodborne illness outbreak database. From that database, we come up with a number of reports. One of the reports that Dr. Raymond was referring to had to do with sort of the top 10 riskiest foods that were regulated by the Food and Drug Administration. And that was right around FSMA, when FSMA was coming out, the Food Safety Modernization Act. We also recently have released a report called Risky Meat, which is doing the same thing, but looking at some of the meat-borne or the outbreaks from meat that were sort of the riskiest, and so sort of trying to categorize which meat products were riskier than other meat products, and that's our meat pyramid. I'm not sure if you can quite see it there. And then we also, in that report, we analyzed the data based on severity of illness, and that was a hospitalization rate. So we do look at the data from a bunch of different angles and to get at some of the attribution that we publish. So a little bit more on CSPI activities. We believe in strong food safety laws, and we work tirelessly to get the Food Safety Modernization Act passed, and now we're working on comments as the rules and regs get rolled out. We also petition the government for action. And we work collaboratively. So we work with the Safe Food Coalition. We work with Make Our Food Safe. We also work with Keep Antibiotics Working. I sit on a National Advisory Committee. My friend and colleague Sarah Klein sits on a National Advisory Committee. Caroline sits on AGASAR. So we work collaboratively quite often. And I think the crux of what we do can sort of be summed up in what's making us sick. And so I'm going to go through now CSPI's research into that question of antibiotic-resistant foodborne pathogens, and then talk a little bit about some of our other initiatives with policy and advocacy work. So I'll start with the research that we've done onto the issue of antibiotic resistance from foodborne pathogens. So we have, through a literature review and data that's available publicly, put together a study of 55 outbreaks in the United States from 1973 to 2011. This does not include the 2 recent Foster Farms associated outbreaks. And we analyze the food vehicle, so attribution, look at etiology, and then look at the World Health Organization categories of antimicrobial risk ranking, and then look at multi-drug resistance. there is an outlier in this database. In 1985, there was a Salmonella typhimurium outbreak from pasteurized milk, which sickened over 16,000 people, hospitalized close to 3,000, and 18 died. And you can't look at the numbers without sort of seeing that reflected in there. So I think it's important to note that outlier. So starting with the World Health Organization's list of critically important antibiotics, aminoglycosides, carbapenems, cephalosporin, macrolides, fluoro and other quinolones, glycopeptides, penicillins, and then looking at the list of highly important antibiotics. This is one of the ways that we'll look at the data in this report. And I do have a couple of reports available with me if you want one. They're also available on our website. So all of this that I'm talking about, none of it's hidden. Everything's available and accessible to people who are interested. So one of the ways we cut the data of these outbreaks was to look at resistance in the outbreaks to critically important antibiotics, to highly important, and a few that weren't classified by the World Health Organization. So what you see here that I think is sort of interesting is it's a way of looking at the medicines that are most important in human medicine and how they're showing up in the foodborne illness outbreaks that we see in this database. And so of those, we're concerned obviously about streptomycin, ampicillin, and a few others that are showing up in the outbreaks. And 47 out of the 55 were tetracycline resistant. And so with the conversations we're having about mobile plasmids and tetracycline co-selecting, I think it's important to note that resistance. So we started in the 70s and looked at outbreaks, and then we went through to the 80s, and then the 90s, and then the 2000s, and more in the 2000s, more in the 2000s, more in the 2000s, more in the 2000s, and then into 2010. And before I get in trouble from Dr. Scott for an ecological fallacy, I'm not going to say that a trend exists there, and outbreaks may be increasing over time, but I think it's something that if we look for it, we're going to find it. And so as we're looking for these resistant outbreaks and resistance in outbreaks, we're finding it. And so not going to say there's a trend analysis that should be conducted with our database, but I do think it's important to sort of raise the question of what we look for and what we'll find. So this is looking at attribution, so trying to figure out what of these resistant outbreaks, what foods they were related to. The largest number were related to dairy. Ground beef came in second. Poultry would still be in third, including the 2 foster farms. That would bring it up to 9. And then produce, seafood, pork, eggs, and some multi-ingredients, and also some classically foodborne pathogens that they just couldn't tease out exactly what ingredient or food item it was. So then we look at etiology. Salmonella typhimurium, other Salmonella, Salmonella Newport. We do have some E. coli, Campylobacter, and a Staphylococcus aureus. You'll notice the asterisks there. There were 2 outbreaks that had multiple Salmonella etiology as part of the bacteria that was causing the illness. So that's why the numbers, if you were to add them up, wouldn't add up to that total of 55. They'd add up higher. Then we also looked at individual drug resistances per outbreak, and more than 15 outbreaks showed more than 7 resistance patterns in them. So multi-drug resistant, it's not just 2, it's not just 3, 4, 5, 6, but in 15 of the outbreaks we saw resistance to 7 or more antibiotics. So as part of fostering an open conversation about sort of how we deal with this, I think risk communication and risk management concepts are important for us to just talk about in Decipher. And just quickly, I'll step back a second. Just total numbers that we see in this database, if you're interested in looking at the report. We saw 21,000 illnesses, 3,235 hospitalizations, and 27 deaths. And so a significant number, but certainly the tip of the iceberg, not meant to be a complete picture, but enough for us to, recognize that people are getting sick from foodborne illnesses that are antibiotic resistant. So some risk management concepts. a hazard that's reasonably likely to occur. It's the foundation of our HACCP-based controls. Known food safety risk of a particular food, sort of what we based FDA's FSMA modeling on, and then performance standards. So you look at contaminants that are specific and science-based, and then aim at appropriate reduction of that risk by serious illness or death to humans and animals. So prevention versus crisis communication. So what we're aiming for, an ounce of prevention is worth a pound of cure. And that's really what the database is trying to do, and the other work we do at CSPI is trying to do. It's trying to sort of look at an issue and say, how do we prevent this from occurring in the future? How do we work towards prevention? But what we too often hit is, don't let a good crisis go to waste. And we certainly don't shy away from media when coverage of the Foster Farms outbreaks and other things are in the media. The government shut down. We were in the media quite frequently. So that's too often, I think, the communication that people may hear from CSPI. So planning a response. And I think there's some lessons to be learned here sort of historically. So when we think about mad cow disease, another term, sort of like superbugs, it scares consumers. So anticipating BSE's emergence in North America, that started in 1996. And so when the emergence occurred early in the 2000s, the result was that it was a well-researched risk communication strategy, and there was a clear statement of the risk in relation to other hazards in consumers' diets that resulted in only short-term declines of consumers' consumption of beef. So I think there's a lesson to be learned here about how to communicate risk to consumers. Unlike the alternative, which happened if you look at, in 2008, the tomato and jalapeno recall, you see dips in consumer confidence tracking over time, and then you see dips in consumer confidence after the peanut butter recall. So, part of the risk communication, it really has to be consumer-facing and letting consumers, sort of being open and honest about what's there. So what is risk communication? It's the interactive exchange of information and opinions concerning risk and risk management among risk assessors, risk managers, consumers, again, we're glad to be here, and other interested parties. Transparency is a key objective, and its importance cannot be overemphasized. So when we're talking about use of antibiotics, that transparency needs to be very important for consumers, because otherwise there will be a trust issue. If you're not being transparent, there will be red flags raised with consumers. So that transparency from government, from industry, I think it cannot be overemphasized how important that key objective is in risk communication. And then the involvement of stakeholders can contribute to issues identification and characterization. It provides data and other inputs for risk assessment, provide alternatives or options assessment, and develop consensus or provide an outlet for public concern. So sort of thinking about data gathering and Caroline's work with AGASAR. So the data collection function of AGASAR will generate information of interest to multiple parties, including risk managers, the food industry, retailers, and consumers. Producers may be concerned in this conversation because of the disclosure of information about practices that they're not prepared to address, and consumers may be concerned that that result demonstrates that their food is highly contaminated. But risk managers must be prepared to address concerns of stakeholders at any point during the data collection process. So thinking about how the World Health Organization, FAO, and OIE work on One Health approaches, the World Health Day focus, they had some core actions for antimicrobial use in food-producing animals. One was to provide national leadership and collaboration, to create and enforce regulatory framework, to strengthen surveillance and monitoring, promote education and training on antimicrobial use in food-producing animals, and to reduce the need for antimicrobials through better animal husbandry. And even the USDA in risk management, there are two quotes I'm going to share here. Animals, when exposed to antimicrobial agents, may serve as a significant reservoir of resistant bacteria that can transmit to humans through the food supply. And the economic impact of antimicrobial resistance is significant. Insufficient or failed treatment, there's a huge human cost. So in the vein of transparency, this is in CSPI's report, and Dr. Raymond, you will notice nowhere in our report do we use the 80% number. what this shows, you're welcome, what this shows is a breakdown of that sales data. So what's given to us by Section 105 of ADUFA, the Animal Drug User Fee Act, is aggregated sales data. And we think one of the best ways to present it is as it's given to us. So not trying to draw too many conclusions from it, not trying to go farther with the data than what we can. The one thing we have done here that's different than maybe the way other people display it is we look at the World Health Organization's status of ranking. So we look at those critically important, those highly important, and those that aren't ranked. And you'll see ionophores, they're not ranked as important in human medicine. So we're transparent in saying that. And getting to Dr. Raymond's point about macrolides, maybe that's a place to start. WHO ranks them as critically important, and you can look here in our data set, and it's one that is important. And so I think displaying the data this way is appropriate and useful. The other place that we look is we look at NARMS data, so we don't just do our own research in coming up with policy. We also look to others who are doing research on policy for policy development. So we look at NARMS, and we try and figure out what's in the meat we eat. And so this is just one way of sort of looking at the data. We look and we see, okay, how much resistance is detected in Salmonella and different food products, and go through the data this way and sort of look at it and think, wow, more than 6 antimicrobial classes. Our database, there are some outbreaks that are happening with more than 7 antimicrobial classes. So just sort of getting a little bit of knowledge that we can from this. And then we also looked at it to sort of be to help us inform policy when we asked the United States Department of Agriculture to declare 4 strains of Salmonella, 4 serotypes of Salmonella as an adulterant in our food supply. And this is, again, getting at that prevention. Rather than crisis management, getting at prevention. So we see this as a way to prevent illnesses from occurring. So we asked USDA to declare as an adulterant 4 serotypes of Salmonella that we know are linked to be antibiotic resistant. So Salmonella typhimurium, Salmonella Hadar, Salmonella Newport. And because we looked at NARMS data, we knew that Salmonella Heidelberg was going to be concerned. At this point, we hadn't seen it in our database, but we did see it in NARMS. So we included it in our petition. And so what our petition to the government, USDA, would do that we filed in 2011 would be to declare any of these Salmonella serotypes that are drug resistant that show up in ground meat and poultry to be declared adulterants. So to get at that prevention from this angle. And the rationale behind the legal bearing of this is if you follow the logic model that antibiotic use selectively chooses for antibiotic resistant pathogens, and if by the hands of man we're using those antibiotics in inappropriate ways, that it's not naturally occurring anymore. And so that's sort of the basis of our petition. We also don't leave off the hook other government agencies. So the Food and Drug Administration, with Section 105 of ADUFA, the data is just too aggregated. Right now, it needs to be teased apart. And so, Craig, expect comments from us November 27th, I think they're due, on how to better display this data. And then we also, talking about FDA, we've talked about Guidance 209 and 213. It's a first step. It is not regulation. It doesn't go as far as the extra label cephalosporin ban. It doesn't go as far as the fluoroquinolone ban. But it's a first step to a problem that's, I think, in urgent need of being addressed. And so the guidance is, as we all know, they voluntarily seek to ban the use of antibiotics to grow animals faster. And they move all the over-counter uses under a veterinary supervision. So these are good things. We do have some concerns with the guidances. We're worried that they do not outline how FDA will monitor the effectiveness, and I think that's very important. The first day when public health was talking about that assessment process, I think it's very important to assess the effectiveness of any policy, and so I think that that's one thing that's missing in the guidances. And then I think it's also important to clearly outline what are considered preventative uses. So we've talked about regulation and petitions and guidances, and we don't shy away from lawsuits either. We're involved in some litigation right now, along with the Natural Resources Defense Council and others. In 1977, the FDA filed notice of opportunity for hearings to gauge the safety of penicillin and tetracyclines. Those hearings were never held. I was born in 76, full disclosure. That's 36 years ago. 36 years ago that the FDA filed these notice of opportunities of hearings, and the hearings never happened. So CSPI, along with NRDC and a few others, is in a lawsuit right now trying to have those hearings held. Full disclosure, we're part of Keep Antibiotics Working. We're one of the founding members of the group of Keep Antibiotics Working. They have over 11 million members nationally. And we are in support of PAMTA, as well as the Prevention of Antibiotic Resistance Act. And one of the things that Keep Antibiotics Working does is they keep a list of endorsers. And just so folks know, PAMTA is endorsed by the American Medical Association, the American Nurses Association, American Academy of Pediatrics, the American Public Health Association, and more than 4 other organizations have pledged their support of this legislation. So I think it's important to sort of recognize CSPI's alliances and allegiances on some of the issues that are talked about here today. Because of the importance of the antibiotics that PAMTA covers, lincosamides, sulfas, tetracyclines, aminoglycosides, macrolides, streptogramins, cephalosporins, and penicillins, we think it's kind of the gold standard of what legislation could accomplish. I just want to sort of touch on advocacy. And so we just heard about the research that CSPI does, sort of that attribution, what makes us sick, and then talked about, as well, the policy that we dip our toes into, and now I just want to talk about some of the advocacy work that we do. So the GAO report came out in 2011, and this was one of a better schematic that I saw of how to describe sort of what the GAO report was describing. So antibiotics that are routinely given to farm animals, they kill susceptible bacteria, but resistant bacteria survive, and they can be transmitted. And they can be transmitted not just through the food we eat, although that pathway in the middle is the one that CSPI is sort of most familiar with because of our outbreak database. But they can also be transferred via wastewater and soil, and that can be to fish. We heard a little bit about poultry being fed to fish, fish being fed back to poultry. So fish, fruits, vegetables sold as food, that can also be a pathway. And then other farm animals on the farm, they can pass it back and forth for each other. And one of the pathways that's missing in the schematic that I think is important to point out, and it's one that isn't talked about all that often, is that humans can pass back to farm workers, back to animals, resistance. And so I think that's one of the pathways that's important to include here that isn't necessarily included in this schematic. So I want to talk a little bit about some of the logic models that we were talking about, and just to think about consumer advocates' understanding, to think about who consumers are and the messages that they're getting and kind of what they understand of their understanding of antibiotics. So I think consumers understand that antibiotics are important in human medicine. They know that antibiotics are used to treat infections. They may not always know whether they're used to treat bacterial or viral infections, but they know that they're useful in treating infections. And more consumers are recognizing, because of a lot of media campaigns, CDC has a Get Smart Week that's coming up, I think, next week, where they address some of these issues. So there are very important campaigns that are being run by public health organizations to let consumers know that antibiotics aren't going to work on your flus, they're not going to work on your colds, they're not going to work on your viral infections. And so that message is getting across. And then just thinking again about, as antibiotic use increases, antibiotic-resistant pathogens will proliferate. They can enter our food supply and people can get sick. So this is what sort of consumers understand. They understand that people take antibiotics when they're sick. They understand that antibiotics are only available to them with medical consult from a clinician. And they know that antibiotics are only available with a prescription. So when they think about giving antibiotics to animals, they think that that must mean that the animals are sick. And I won't even dive into what consumers would think about eating sick animals, but the idea that antibiotics are given to animals, that just because they only get antibiotics when they're sick, it means that the animals must be sick too. And so when consumers learn that antibiotics are given preventatively for animals that aren't sick, there's even further lack of understanding. And then that lack of consistent veterinary oversight that's different from human medicine is a really hard thing for consumers to understand. They don't understand why they can't get antibiotics without a prescription, but food animals can be given antibiotics without direct veterinary oversight in some circumstances. So just to talk a little bit more about consumer advocates' understanding, they understand that giving antibiotics to healthy animals in low doses can help speed along and the proliferation of antibiotic-resistant bacteria. They also understand that they can get sick from antibiotic-resistant infections when their food is contaminated. So CSPI has, like I said, 1 million members who subscribe to our Nutrition Action Health Letter. And so when we ask for their help and support on any of our policy issues, we get a pretty good response. And because of the reports that we issue and because of the work that we do, these aren't maybe your average consumers. These are consumer advocates. And just to, again, because I'm representing all consumers, which seems like a very big task, what we hear again is consumers want alternatives to animal production. It's not an easy fact. Consumers also like cheap food. But we do know that consumers want alternatives. When they see these pictures, it's not the rural farm with a cow grazing in the grass. There's sort of a disconnect between how that cellophane wrapped package of chicken that they buy in the grocery store is actually produced. And when they learn of it, they want alternatives. And so talking about pink slime and some of the other things, I think it's important to know what media messaging is out there. This is not CSPI's work by any means. We can't control how media tackles things. But I think it's important to know that this messaging is out there, and it goes back to the title of my presentation. There is a consumer perception that superbugs are in our food supply. And so pink slime happened because of one angry mom. I think her name was Bettina. I think there should be some warnings for folks because I think it's very important to control messaging and to think about messaging. But some of the messaging's already out there in the media. There's another one. This is other messaging that's out there. And this isn't CSPI's doing. This isn't Pew's doing. This isn't any one individual organization's doing. But it's important to note that messaging like that is out there for consumers and is meant to enrage consumers. So I think it's important to be aware of the consumer message that is out there that, superbugs are in the food we eat. And that's, I think that's troublesome. And then just to sort of wrap up here, I think there are significant impacts on human health. And like Dr. Raymond said, I cut my teeth in advocacy working with individuals. Before I moved from STOP to CSPI, I met Danielle Wadsworth. She was sick from Salmonella typhimurium. She ate ground beef, and she was filled with questions when she found out that the strain of bacteria that she got was antibiotic resistance. And the question just kept coming. Well, why do they give antibiotics to animals? Why won't they just give them when they're sick? Why do they need them? So just questions from a consumer like Danielle, who I would call a reluctant advocate. Danielle didn't want to get sick. She didn't plan to get sick, but she did. And so now she's a reluctant advocate. She's somebody who travels to Capitol Hill and will meet with representatives. She's somebody who will travel when we ask her to, or when other organizations ask her to, because she's impassioned because she got sick. So there are real costs here. There are real people who are involved, and I think it's something that needs to be addressed. And Danielle's just one of them. And going back to sort of the real costs, this number is out there. This figure is out there too. $16.6 billion to $26 billion annually. Antibiotic resistance costs the U.S. healthcare system. So when we think about costs, it's not just then Danielle Wadsworth's. There are also other costs to the healthcare system. And so finally, I want to offer some solutions because I think that part of the conversation needs to be solution-based. So I think we can agree that antibiotics are losing their effectiveness due in part to the overuse in food animal production. I'm not saying that all antibiotic resistance is there. We heard from CDC, we heard from Steve Solomon, we heard from Rob Tokes. You'd hear from us that there is a problem with antibiotics being overprescribed in human medicine as well. But in part, the overuse in food animal production is leading to antibiotic-resistant infections in people. There is a consumer interest that there is a need to preserve effective medicines for fighting infections, and that resistant bacteria that are associated with foodborne diseases, that needs to sort of get reined in. And there are also residue issues, and I know Dr. Goldman talked a little bit about this, but there are allergen side effects, other things that we worry about with residues as well. And so some recommendations. EU policy banning non-therapeutic use, we think that's a great place to start. We think looking at the World Health Organization's critically important list as a way to target where to rein in use is also important. And removing critically important human drugs from animal food chain altogether would be kind of the best place to go, but I don't think we'll get there, and I don't think I'm going to change that many minds in the room today. Probably haven't changed any, but I think it's good to at least hear the perspective of one consumer advocacy group.